It is essential that health professionals foster skills in working in groups and teams to ensure positive outcomes for their patients. This PowerPoint will discuss what a group is, the life cycle of a group, and the types of teams regularly seen within health professional settings. Skills required for a team to function successfully will also be examined. A group may be defined as a number of people or things that are located, gathered or classed together, or a number of individuals assembled together and having some unifying relationship. There are three different types of groups: primary, secondary, and therapeutic. Primary groups are groups that do not have a set structure and generally have a social aspect associated with them. These groups are often voluntarily formed. Examples of a primary group include families and mothers groups. Secondary groups are groups that are formed to serve a certain role or purpose. They're well structured and generally have an identified leader. An example of a secondary group would be a working party. Therapeutic groups are groups that are formed to provide emotional and psychological support to its members. An example of this type of group is Alcoholics Anonymous. Groups generally follow a 5-phase cycle. The first phase is forming, followed by storming, then norming, then performing, and finally adjourning or mourning. Let's look at these phases a little closer. Forming. This is the initial phase of a group life cycle. As the group is new, members are taking time to assess the task as well as other members of the group. Most team members will be positive and polite in this stage of the life cycle. Storming. This is the phase where members become confident in themselves and their evaluation of the rest of the team members. Members try to push the boundaries that were set in forming stage. Sometimes there is conflict and frustration between team members due to different working styles or jostling for position or authority. This is also the phase where teams tend to fail. Norming. In this phase, progress towards the goal begins. Team members start to resolve differences with others and cohesion develops in the team. Performing. This phase is when the work gets done. The team is fully supportive of the task and goal orientated. There is no friction between team members and respect is maintained for team roles. Adjourning mourning. This phase sees the end of the group, whether due to goal success or other causes. This time is for celebrating achievements. Roles of group members tend to assimilate with one of three main role descriptions: the group task role, the group building or maintenance role, or the individual role. These roles are not set in stone. A member may display behaviour from all three role descriptions in one meeting. Group task role. This role has leadership properties and the dedicated team leader should assume this role. The group task member suggests ideas, gives information, or seeks the opinion of other team members. Although the team leader should assume this role, others in the group can also display this role. An example of this role is the initiator contributor, who proposes new ideas or changes ways of doing things. Group building or maintenance role. This role can take several forms, but it is designed to encourage others to participate and trying to harmonise a strained relationship within a team. An example of this role is the encourager who offers praise, commends, and agrees with or accepts other members' opinions. Individual role. The individual role describes a person that is taking an ineffective position in the team. There are several forms of individual roles, but a good example is a blocker. This person attempts to block constructive suggestions from other members, thereby slowing progress of the team. Group issues. There are many reasons groups have issues or fail. Some of the most common include disorganisation and lack of direction or leadership, unclear goals and expectations, competing commitments, lack of motivation or dedication, as well as conflict. Strategies. The main strategy to ensure the group remains effective is to develop ground rules from the start. These ground rules should encompass how the group will communicate and time periods for this, how decisions will be made by the group, analysis of the task and distribution of workload amongst members, and discussing and aligning roles to members based on strengths. Conflict. Conflict within a group is one of the most difficult issues to overcome. By considering this step-by-step guide, conflict may be identified and resolved before impeding the group's effectiveness. Health professional teams. There are three main types of teams seen within the healthcare setting: the unidisciplinary, multidisciplinary, and interdisciplinary teams. Unidisciplinary. A unidisciplinary team approach is sometimes referred to as the one health professional approach. This team compromises of one health professional and the patient. An example of this type of team is a patient attending a doctor. At this meeting, the team consists of the doctor and the patient. A care plan is devised and the patient is sent on their way. This approach is appropriate for less complicated health requirements, diagnosis and treatment. Multidisciplinary. A multidisciplinary team is composed of health professionals from more than one discipline. Team members work independently and interact formally. Multidisciplinary teams may be thought of as requiring everyone to do their own thing, with little or no awareness of other disciplines' work. The patient's problems are subdivided and treated in parallel, with each provider responsible only for their own area. An example of this type of approach would be a patient visiting both a cardiac specialist for heart-related complaints and an endocrinologist for their diabetes issues. These specialists would be treating the patient for their specific fields without knowledge of the other health professional's care plan. The major disadvantage of this model is that it addresses each individual impairment separately, tending to lose sight of how these impairments affect the individual as a whole. Interdisciplinary. An interdisciplinary team is a group of health professionals who work interdependently in the same setting. Separate assessments may be conducted, but team members work to achieve a common goal. Interdisciplinary cooperation requires integration or even modification of the efforts of the contributing disciplines. The team process requires that the members take into account the contributions of other team members in making their own contribution. An example of this type of approach would be a patient that has multiple comorbidities, including osteoarthritis, obesity, diabetes, and chronic depression. This patient may be seeing a physiotherapist to assist movement restrictions due to her arthritis, a dietitian for her obesity and diabetes, and a psychologist to assist with her depression. These comorbidities impact each other, yet could be treated independently by these health professionals. In an interdisciplinary team, the health professionals will treat this patient holistically to obtain the best health outcome for this patient. There are a number of skills that members possess that are beneficial for a group to function successfully. Communication is an essential skill to be successful as a health professional and is a requirement for successful group outcomes. Unspoken assumptions and issues can be very destructive to productive group functioning. Interpersonal skills are beneficial in a team environment as these skills are required to interact successfully with other members. Interpersonal skills allow appropriate communication and interactions between members of the team as well as key stakeholders. Time management skills promote success in teams by ensuring goals are met in a timely fashion. This skill also helps with the organisation of the team. Problem-solving skills are beneficial in the success of the team. Problem solving not only assists in resolving issues faced by the team in achieving their goal, but also helps in resolving inter-team issues. Listening skills are one of the most important skills in a team. Listening ensures suggestions and information shared by other team members is validated. Assertiveness skills allows an individual to express their opinion even in an environment that may be hostile. This ensures that all suggestions are discussed and considered to provide the best outcome. The use of health professionals from a variety of disciplines in groups to support the holistic diagnosis and treatment of patients is becoming more common in modern medicine. Development of skills to ensure success in teams is essential for success as a health professional.